Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. Dr. Garza will make brief remarks and then address questions that have been submitted by members of the media prior to or during today's briefing. Members of the media who have questions during the briefing may submit those to the Task Force Public Information contacts, and we will attempt to address them during the live stream or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you, and good afternoon, everybody. I hope everyone had a really nice weekend and a very pleasant Mother's Day for all those mothers out there. As we noted over the weekend and in our updates, we continue to see some important progress in some of our key data points. And those are all really good signs as the more and more we look to gradually and smartly reopening the economy. And we'll need to keep those data points in mind as we begin to take the next steps as well. And as we reopen, it will be even more critical for us to practice all of those evidence-based things that we've been doing so far, such as socially distancing, washing our hands, keeping surfaces clean. All of those little things really contribute to keeping transmission down. The concern is if we fail to continue using those practices, that will be increasing the likelihood of a second and more serious wave. So let's make sure we don't forget all of those lessons that we've learned so far. And we don't want to go backwards either. And so the only way to really continue going forward is all of those tried and true ways to prevent transmission. And really, our future is in our hands and the community's hands, and we'll decide how fast or slow or backwards we go from here. So let's all keep that in mind as we continue to look forward to the relaxing of some of our shelter in place and other restrictions. So I'm going to go ahead and show us the hospital admissions rolling average here. And so this is the chart that continues to show some really significant progress. And then again, it shows the trend in the daily new hospital admissions since early April. And the rolling average has fallen steadily since early April with a few upticks. Now, the data reported on this chart are lagged for about 2 days because we want to make sure we're capturing all of the COVID positive patients. And as you can see here, so the latest reporting date is on Saturday, where we admitted 16 new patients, which is, I believe, a new low since we really began tracking this data. And our rolling average fell to 29 as well, and so this really continues the trend downward. And this is a trend that we want to continue to see keep going down as we move forward. So now let's move over to another data set that we show. And this is our hospitalizations rolling average. And we're continued to be encouraged by this fall in data as well. So this chart shows our daily hospitalized patients for COVID positive and suspected COVID patients, and the rolling average as well. And in early April, that number was rapidly climbing, as everybody knows. But today it's around 563 and is trending down. And so as this number continues to come down, it helps us be confident in the steps that we're taking and that the healthcare systems are going to be ready and able to take care of COVID patients without becoming overwhelmed. So also our healthcare systems will continue to advise and support our public health partners with their community testing strategies and other things, and to ensure that we can do everything that we can to keep that transmission rate as low as possible. So let's update the numbers now. So we have 492 hospitalizations today of confirmed COVID and suspected COVID patients, and that's down from 505 yesterday. And I believe this is the first time we've been below 500 since we started reporting the data back on April 5th. So that's a nice milestone. And we have 131 confirmed COVID or suspected COVID patients in the ICU, which is down from 140 yesterday. And we have 98 confirmed COVID or suspected COVID patients on ventilators today, which is, again, down from 111 yesterday. And yesterday, the task force healthcare systems discharged 11 patients from our hospitals, and that brings our cumulative total to 1,674 since we began tracking this metric. So thanks to all of the healthcare workers and everybody who's really worked tirelessly in taking care of these patients and getting them back home. So just in summary, these data are really starting to show some of the good progress that we've made from all of those sacrifices that we've done throughout the weeks. However, we can't become complacent either by all this good news. Remember that this won't be a return to the pre-COVID times. The virus is still out in the community. There's still significant numbers of the population that are susceptible to the virus. And so we still have to continue doing all of those things that have brought that transmission rate down as we gradually and slowly start re-engaging in the economy. And it's really up to us as a community to not slide backwards. So let's make sure we're practicing all of those things that prevent transmission out in the community. And we'll continue to follow this data as well. And so we'll continue this all the way up to the 18th of May to make sure that we believe that it's safe for us to start opening the economy and become a little bit looser restrictions. And we'll continue to follow the data after that as well, just to see how we're doing and to make sure we're not creeping back up. And so with that, I'm now going to turn it over and answer some questions from the media.
The federal government is in charge of distributing the drug remdesivir, which has been shown to speed recovery from COVID-19. There's been some concern over how hospitals are being selected to get the drug. When are St. Louis area hospitals expected to receive the drug? And are our hospitals concerned about the process?
So the process for remdesivir has been a little bit challenging on how the medication was allocated. And so from what I understand from some email traffic that I saw this morning, the state of Missouri does have some doses of remdesivir that have been allocated to it. And I believe that they're trying to figure out how those are going to be allocated to hospitals throughout the state. Now, certainly you would think that the doses would go to those areas that are hardest hit. Of course, St. Louis is the hardest hit area in the state. But there's still discussion at the state on where those vials are going to go and how much of the drug we're going to be receiving.
One of the biggest ways people get infected is in their home. Do you know of any specific plan in the works to help people who test positive and are unable to effectively quarantine at home?
Yeah, that is true. And so some of the plans that have been discussed with public health right now are, and it's exactly right, how do you help people that aren't able to effectively isolate and quarantine at home, particularly people that, aren't able to separate from their families or have child care issues, things like that. And so part of the discussion that's ongoing is how can you almost like build a kit for people to be able to quarantine at home? So whether that's, with masks and gloves and thermometers and stuff like that, or how can you help out with things like child support and food and all sorts of other things. And so there is discussions about that. I don't think there's anything formally put together yet, but there are discussions on how we can go about doing those things.
This reporter writes that she's curious about antibody testing in St. Louis. She writes, I know the state has done in-depth snapshot tests around the state, but is there a similar effort or strategy happening in St. Louis or St. Louis County? And if so, what's the status?
So I believe there has not been any antibody-based quote-unquote snapshot tests. I think what the reporter's asking about is what's called a prevalence study, where you do random sampling throughout the community just to understand how much disease is out in the community. The state has done that with the PCR-based test, which looks for active infection. Serology looks for past exposure to the virus. And so there's been some states like California and New York who have done that. But as far as my knowledge, the state of Missouri has not done that yet. Now, there are discussions in place and plans are being built to do just such a test in the St. Louis metropolitan area. And that's really to look at the community to see how many people have been exposed to the virus. Now, if you recall from some of our earlier press conferences when we said we believe that 70,000 people, 71,000, would have been infected with the virus by the end of April. This is really what that number is going to be getting, or what that testing would be looking for, is how many people have been exposed to the virus out in the community, both asymptomatic, symptomatic, all the other categories.
Thank you. That concludes the list of questions that have been received by the Task Force Public Information contacts for today's briefing. There will not be a live stream briefing tomorrow afternoon. Instead, the task force will distribute the latest numbers via press release, and the next live stream briefing will take place Wednesday afternoon. Thank you.